All right, so Breakfast Daily, more conversations happening. Of course, the hashtag is Breakfast Daily. WhatsApp line is 0550-585-832. Hashtag also is Heritage Month on City. Now, we know the president, has given us a new update, which means that basically we are living with a new normal. Now, we're going to be looking at some interesting conversations with Dr. Kelvin Owusu discussing cholera. Yesterday, we were having a conversation with the Ghana Medical Association, and they were saying that, interestingly, throughout the COVID, cholera was almost zero. Basically virtually zero, just because of our practices, throughout COVID. And of course, what does it mean also to live in this new era with knowing that COVID is sort of lurking in the background? How do we do this? Dr. Kelvin is the head of occupational health and wellness at Claron Health International. Dr. Kelvin.
David.
How are you?
Very well, and you?
I'm great, thank you. Thank you. Have you recovered from back to your village football?
Oh, I mean, it was an awesome experience. I'm reminiscing. I'm trying to hold on to the memories.
Charlie, it was something else, man. It was something else.
It was.
Anyway, so let's just get into it.
Yes.
Because I was very surprised and impressed to hear Dr. Biyo actually, say that cholera was virtually zero.
Yeah.
Throughout COVID.
I mean, when I put up the poster about this discussion, somebody was like, "What's the connection?" I mean, cholera we know, so COVID, what's the connection between the two?
Yeah.
But you are right. I mean, since the COVID outbreak, cholera has actually, sort of disappeared. So people are forgetting about it, but it's still there. I mean, it was near zero, but it wasn't zero actually. And you mentioned the practices, which is very, very true. One of the key things, and I think I mentioned it way back in one of our sessions, that the hand washing alone.
Yeah.
If we are to be thankful for anything that COVID has done for us, is that it has made us recognize how important it is that hand washing is to our health. So just by washing our hands, it has helped us to reduce the occurrence of cholera. And so it's a reality. But then this presents the challenge when now the restrictions are being eased. And some people are now of the opinion that those of you that took the vaccine, you wasted your time because now COVID is no more, because now even the president agrees that COVID is no more. Well, I mean, and that's what's going to cause problems now. It's because with the announcements that of the easing of restrictions, the perception is that COVID has been dealt with. And so people are going to, there's going to be a rolling back of the gains we've made with respect to our personal hygiene. And that's a problem that we hope to prevent by talking about it some more, so that people are aware that COVID, in fact, was protecting us, in quotes, from cholera.
No, I agree with you. And I think it's also important. One of the things, it's funny, because this morning I was in a dawn prayer meetings session with my pastor, and he's a medical doctor. So he made reference to something. He said one of the practices that he always insisted on, personally, and then for those of people who lived with him and were around him, was the mindset that you're going to something like a public lavatory facility, right? And you finish using the lavatory and you wash your hands, but when you are exiting, you touch the handle, right? Remember when COVID started, the whole issue of touching surfaces was a major topic that we dealt with. I think it's very important to realize that thousands of people have been touching the handle. Not all of them have clean hands. And so you may have just washed your hands, but and you're feeling all good.
You've just contaminated it.
Touch the handle and contaminated your hands.
And not everybody who actually touches the handle had actually washed their hands.
That's it.
So that's real. I mean, that's real, right? And you see, when we talk about the rolling back of the gains, it has to do with individuals as well as institutions, because you go to places and they made sure that there was water, even if the tap was not running, there was a barrel with water. All those things, there's a probability or there's a possibility that all those things are going to get lost, which is going to create a problem for the rest of us in trying to maintain personal hygiene. I mean, there were places, offices where they actually changed the handles from the regular open to the pushing, and now all those things are going to be, it's going to be lost. So I mean, cholera is a big deal.
Hopefully some people will take it more personally.
I hope so. I seriously hope so.
We're still going to have our water outside. If we will insist on people washing their hands, but it's available, so that if you do want to wash your hands, you can use that. Yeah.
Yes. And I mean, I must say that the fact that there's been an easing of the restrictions does not actually mean that COVID is not among us. It is still among us.
Yes.
It is still causing disease in some people. I mean, the rate of severe disease has dropped because of the vaccination rate.
Okay.
And the vaccines are still available, so people are still supposed to go and get the vaccination. In fact, if you are traveling and you're not vaccinated, you still go through the restrictions. So the easing of the restrictions is actually in reference to people who have actually been vaccinated. When it comes to wearing the face mask, for instance, if you know that you are going to a crowded place, especially if it's a crowded place inside an air-conditioned, room, you need to still protect yourself because you still need to make sure that you are minimizing your exposure to the COVID as much as possible. So it's an easing of restrictions, but COVID is still around us. I mean, it's a new normal. It's not going to go away, really. It's going to be with us. It's going to still affect people. There are going to be periodic spikes in the infection rate. So we really still need to take responsibility because ultimately you are responsible for your own health.
Yes.
It doesn't matter what the government says. It is your responsibility to make sure that you are of good health and can continue to do your economic activities and stay engaged in the things that bring you income. It's very, very important to you.
No, I mean, having said all of this, I think it's important for everybody to realize that even as the president gave his speech, he also kept emphasizing that vaccinated people who are vaccinated are the ones who can move freely about, and there are places where you have to show proof of vaccination. So for example, if you're flying into Ghana, if you have proof of vaccination, then you will not have to undergo a PCR test at the airport. Otherwise, you still have to get yourself tested, at the airport. So I think this is very important.
Very, very important
for us to bear in mind. I mean, this morning I was joking with Kokui and saying that, well, am I going to have to show my vaccination card at the cinema, when I'm going to? And it may not be, but I think we're going to go through a few years where you literally have to carry your vaccination card with you because it may be called upon
at any
randomly
at
any point in time. Because again, the fact that the president has eased the restrictions, individual institutions still have the right to apply maintain whatever restrictions they want to apply.
You're right. So you're right. But let me. So what makes this cholera discussion even more relevant is because the rains have started. I mean, we had our first major rain, I think, in the past week in Accra. I mean, and even in Koforidua, there were pictures of some flooding here and there. So I mean, the rains are coming. March is ending, April is beginning. We are going on to June. And the rains, coupled with our choked gutters and our poor sanitation practices, is going to cause the spike in the cholera, what's it called, cases. And then now, if we do not also we do not continue with the personal hygiene that COVID has made us become more aware of, then the problem of the cholera outbreak is going to happen. There's always some number of cholera cases that we get, a stable number. We don't want it to. In fact, we want that number to drop, so that cholera, because really cholera is such a basic disease that we shouldn't be dealing with it in the year 2022 at all in any way. So whether COVID came or COVID didn't come, we should not be dealing with cholera at all. I mean, cholera basically is a disease you get because, sorry for those who may be eating, you are literally eating somebody's,
feces,
excrement. Yes. That's basically how cholera is spread, fecal oral. So if there's a cholera outbreak, it means that our drinking water, our cooking water, especially our drinking water, our cooking water, our hands are not clean, and that's why we are getting cholera, which is something that other people dealt with in the 18 years, so long ago. So we shouldn't be dealing with cholera at this point. And so with the coming of, we need to be even more aware, more conscious about where we get our food from, what we do with our hands before we eat. I mean, you need to wash your hand, and it's not just about washing the hand, it's washing the hand with soap. And the running water, is the ideal. So wash your hand with soap and the running water. And as we learned from COVID, you have to wash it in a particular way for a particular number of seconds before. Exactly. So all these are things that it should stay with us so that we can protect ourselves not just from COVID but also from cholera, which definitely costs a lot of money to treat, both on the national level and on the individual level as well.
So, I mean, hand washing is one thing, personal hygiene, making sure that you're clean and everything else, and you don't touch surfaces and all that. What would be, let's say, water has been contaminated, but you're not aware,
True.
How would you then advise people to live aside of the personal hygiene?
So, I mean, this is a community issue. You know, sometimes, and it's rather unfortunate that when there's a broken pipe, instead of reporting to the Ghana Water Company or whoever is in charge for the pipe to get fixed, people rather, you know, rush their place to fetch the water. I mean, yes, it's a symptom of the general, you know, financial situation, but they go there to fetch the water from the broken pipe. Now, what happens is that because that pipe is broken, it's interacting with the germs or the dirt or whatever it is in that area as well. So that anybody who is now in the how do I is it distal? What's another word for distal? Anybody getting water beyond the point of the
the value chain,
exactly, is going to receive contaminated water. You see, and that's a problem. I mean, you are not aware, so you really can't do anything about it. But this is also why you should try as much as possible to make sure to eat cooked food.
Okay.
Or if it's vegetables or fruit, you know, you need to wash it with some amount of salt, you know, or vinegar or something to disinfect it. You know, of course, when I say this, I'm talking about edible disinfectant. Yes. So we have vinegar, we have salt, you know, so that you don't
not
just
like when Trump says drinking disinfectants.
that's not what I'm talking about. You know, so because you don't know what's happening in the supply chain, you need to protect yourself by using appropriate means to keep your fresh fruits and vegetables cleaner. So that you don't catch any disease from something that you have no control of or control over. But the community, we need to also report these things so that it can be fixed immediately to avoid contaminating the water for the rest of the users.
Okay, so finally, let's look at COVID in the new normal era. Some tips and advice for people just generally. I mean, you know, majority of people will not be wearing masks majority of the time.
Yes.
And so how does one carry themselves about to make sure that they are, you know?
I think it starts with the vaccination. I mean, the vaccines are still available. The vaccines are still free. You know, so really this is the time to get vaccinated, because the time will come when they will not be free anymore. We've seen it several times, you know. So this is the time to really get vaccinated. So that's one. When you've done the vaccination, the next thing is to follow the protocols. Like I mentioned earlier, if you are going to a place you know it's going to be a crowded place, you know, especially if it's an indoor setting,
like a cinema.
Like a cinema where you are going to be there for a prolonged period of time. You want to protect yourself as well, you know, because if everybody is not wearing the face mask and there happens to be one person who has the COVID and begins to cough or even talk because it's a droplet thing, many people in that space are going to catch it. So you need to protect yourself by, you know, first of all, knowing where you're going, and if it's a crowded place, you protect yourself. And then when you have interacted with surfaces and people, you need to wash your hand as well. I mean, as much as possible, avoid the handshake still, because COVID is still with us. But if you must shake hands afterwards, remember to wash your hands and then avoid touching your face. I mean, all the things that we've known about all this while, we need to still keep doing them in spite of the fact that restrictions have been eased, because it is still, you are still the president of your life. You know, so there may have been a general instruction, but you need to take responsibility for your own health, because ultimately if you get the COVID, it will be only you in the hospital bed, not all of us. You know, and whether your outcome is going to be good or not, again, it depends on how good your immune system is. It's your responsibility.
Thank you. How can people get in touch with you?
I'm active on social media, Kelvin Owusu MD. You can find me on Facebook, Instagram, even TikTok nowadays.
All right, so I like that line there. You are still the president of your life. So the president of the country has given a general, you know, guidance for us, but you are still the president of your life.